will now move on to the panel discussion on policy considerations in promoting breastfeeding. I would like to call upon the moderator, Dr. Sridhar, along with the speakers, Dr. Usha, Dr. J.P. Dadij, Dr. J.V. Rao, Dr. Jagdish Chandra, Dr. Sanjeev Upadhyaya, Dr. Yadaya, to please step onto the stage. Sirs, please.
First, Dr. Sanjeev Upadhyaya, the current Vice President of the Sushena Foundation, and decades of experience working with international agencies, including more than a decade experience working with UNICEF. Dr. Usha Rani, the former NNF President for the United Andhra Pradesh, former IAP President for Twin City Chapter, Professor of Pediatrics, and also the former Superintendent of Nilofer Hospital. Welcome, Dr. Usha Rani. Dr. J. Venkateshwar Rao was a former HOD of Gandhi Medical College and current Professor of Pediatrics at Mallareddy Institute. Welcome, Dr. Rao. Dr. J.P. Dadij, the Director of Department of Pediatrics and Neonatology, C.K. Birla Hospital at Jaipur in Rajasthan. He was the former NNF Secretary and former National Coordinator for BPNI, and he was also a member of IMS Act and various other acts with IAP and NNF. So he's going to speak about more on IMS Act when we talk about the panel questions. Welcome, Dr. Dadij. Dr. Damira Yadaya, very popular, very famous pediatrician from Telangana and famed at national level. He's the nodal officer at SNCU at a government general hospital in Nalgonda district. Welcome, Dr. Yadaya. Dr. Jagdish Chandra, national faculty for the NNF, for facility-based newborn care, for neonatal transport, for district newborn care, and lot many. He was also the former president of the IAP Twin Cities. Welcome to all the distinguished panelists. I think we have more than 150, 200 years of experience on stage now. So I was looking at all the pre-conference workshops, the basic lactation, advanced lactation, breastfeeding in special circumstances, and you saw all the sessions since the morning, the advanced science of breastfeeding, even the technology, modern equipments, everything. But what is the outcome? What is the result? India, with more than 90% institutional delivery, early initiation of breastfeeding is at 40%, 50% gap. So the knowledge, if not put into practice, that is where the panelists are here to give us recommendations and solutions. How can we improve this coverage through policy considerations and recommendations? So with this background, I'll go to the first question. Dr. Usha Rani, you have worked in the government hospital for so many years. Can you just list all those policies, programs existing at the national level or the state level to promote breastfeeding in India?
A very good morning to you all. Coming to the programs which are existing, so Government of India has initiated several programs which promote breastfeeding either directly or indirectly. Out of them, flagship program of India is a Mother's Absolute Affection Program, that is MA program, which was started in 2016, which focuses on promoting breastfeeding both at the facility and community level. Other programs are maternity benefit scheme is there, which focuses on giving incentive to mothers for wage compensation. As well, and also India Newborn Action Plan also has a major component of promoting breastfeeding. So in addition, we have Infant Milk Substitutes Act, Infant and Young Child Feeding. IMNC also has a major focus on breastfeeding. And also other programs like Prime Minister's Pradhan Mantri Matritva Suraksha Yojana, so many other programs at the national level. And also some of the states have specific programs, like if you take, for example, Tamil Nadu state, they have more than 300 air-conditioned breastfeeding rooms at public places to promote breastfeeding. So the list is long, only thing is implementation. We need to focus on implementing at every level. Thank you.
Yeah, thank you, Dr. Usha, for enlisting all those programs. Dr. Yadaya, so many programs are there, but even in the state of Telangana where you work, 90% institutional delivery, 40% early initiation of breastfeeding. What do you think what can be done to improve the early initiation of breastfeeding, particularly in public health facilities?
And 42% of early initiation against 90% of hospital deliveries. It's really a concern, public health concern. And the babies are subject to the poor optimal infant nutrition. And it is mainly because of there is poor antenatal education regarding the breastfeeding and the mode of the delivery and the lack of skin-to-skin contact. And coming to skin-to-skin contact, there is poor understanding in the healthcare providers and the mothers and the family members. And the positioning the baby and the family support. These are the main things concerned. When coming to the labor room, the baby mother comes directly and asks for the breastfeeding. She don't know what to do. She has not been supported during the antenatal education or the intrapartum, this thing. So the main concern is to explain about the importance of skin to skin and the roaming in 24 hours after the delivery. And allow the baby to go through all the stages of the skin to skin contact, that's 1 to 9 stages, that's the behavioral stages. Then baby will go into the successful early initiation. This early initiation will lead to the successful breastfeeding. That's very important part.
Thank you, Dr. Yadaya. So, Dr. Dajich, you are representing the corporate private sector here. Yeah. So, and if you see the southern states, more than 50% deliveries are happening in private sector. So this gap of institutional delivery versus early initiation breastfeeding definitely would have been in private sector also. So what are your suggestions to engage the private sector?
Well, in private hospital, whatever Dr. Yadaya has just told us about the public sector, I think all of those issues are also relevant for the private sector. I could not find any desegregated data for our country for public and private sector. But I think one thing which is very much prevalent in private hospitals is separation of babies from mother is more in private hospital. And it was found in one World Bank study which was done by BPNI in Uttar Pradesh in 16 hospitals, 4 of them were private hospital. And it was found that separation of babies was more in private hospitals. It is also, and it was more so, it was in the cesarean section. And if you look into the data from NFHS 5, all the institutional number, as you told that it is 88.6% are there, they are happening in the institutions now. The cesarean section rate is 21.5% overall. But in private hospitals, it is 48%. So it is much, much high. In the state of Telangana, it is up to the tune of 60.7%. So this is one situation where separation of babies and mothers are more. If baby is separated, then obviously the initiation will be delayed. So to address this problem, the solution is available to us since last 30 years. And the solution is implementing the BFHI program. In BFHI program, the step 4 is specifically devoted to initiation of breastfeeding within half an hour. So the program was initiated in our country in 93. It was there till 98, then it was stopped. But now Ministry of Health and Family Welfare has taken an initiative. A tool was developed with the help of WHO India, and BPNI did this exercise, and I was part of that exercise. We actually validated the tool in the state of Andhra Pradesh, in the Anantapur district, Hindupur. Dr. Kesolu is here in his hospital also. So that tool is available, and now BPNI is implementing this. So private hospitals can adopt that BFHI and if they do it, then not only the initiation, all other aspects of breastfeeding will also improve in private hospitals. Then few more things can be done. Say for example, private hospitals, they are very much worried about their monetary aspects. So all of them, they want to go for NABH accreditation because insurance and all those things, they require NABH accreditation. So this can be the NABH, the Quality Council of India what can do is that they can put BFHI certification as a mandatory requirement to get the NABH certification. Now what they have is to, there is one indicator that there should be a breastfeeding room for the mothers coming to the hospital, but that is not sufficient. Then also all the hospitals, they have neonatal units, and they go for accreditation from the National Neonatology Forum, NNF. So if they, so in type 2, the 2B units, there is, they can include this as a service because there are many indicators and there are service indicators. And in the service indicators, they can include the initiation of breastfeeding within 1 hour.
We will talk about those indicators, sir, when we talk to Dr. Jagdish.
Yeah, okay.
So, Dr. Rao, so now what all the other 3 panelists told is about how we can improve breastfeeding in the facility concept. But if you want to continue the breastfeeding for 6 months as exclusive breastfeeding and continue to till 2 years, we need that enabling environment. Now, one of those enabling environment is provision of maternity leave. So Government of India recently has increased from 12 weeks to 26 weeks. But this is targeting only those organized sector. So how we can engage the unorganized sector. And again, this 26 weeks of leave is targeting exclusive breastfeeding. But to continue till 2 years, again, we need those reforms in the workplace. So what are your critiques or what are your suggestions?
Yeah. Good morning, everyone. The earlier act, the Maternity Benefit Act 1961, was giving only 12 weeks of paid maternity leave, as we all know. It was amended very recently, around 7 years back in 2017, enhancing the Maternity Benefit Amendment Act, wherein they mandated 26 weeks of paid maternity leave and creche facility and so many other things, including giving them breaks and giving them flexible working hours, working from home, and creating a more enabling environment in the recently amended Act. But there are many challenges in the existing Act before we really think of trying an advocacy to enhance the existing 26 weeks of leave. Because as we know that there are many different factors involved in government as well as in non-governmental and private sector. We really don't know. I just wanted to search and try to find out really this 26 weeks is followed across, even across all the private companies, and very little data I could get. But I suspect from anecdotal references that many private organizations, they don't give the paid maternity leave of 26 weeks even today. That's because we absolutely lack proper, probably monitoring agencies, and we depend on self-compliance, and that doesn't happen. You know very well that in India, we have a habit of, don't take me wrong, but we have a habit of flouting norms and twisting the existing acts also. These are the challenges. And another challenge that Dr. Sridhar was mentioning is unorganized sector. India is a country where the huge working population, and there is a lot of unorganized workers who don't get any kind of benefit from these maternity act and so. So government has to give a legislative support, a governmental initiative wherein they have to mandatorily say that even the unorganized sector breastfeeding mothers also should get the same benefits, and it has to be enacted in a different way. Not only that, the workplace act about the social security of unorganized sector, which was mentioned in 2008, has to incorporate provisions regarding support to the breastfeeding mothers also. And regarding enhancement of the existing maternity leave, I think first we should concentrate more on compliance. Whether they are really complying. If they are not complying, are we going to implement the penal provisions that are already there existing in 2017 Act, wherein there is a cancellation of license, imprisonment, monetary punishment, so many other things, compensation to the employee. Are we able to do that? Do we have the agencies? Because Ministry of Labour and employee service organizations like Insurance Corporation are the monitoring agencies according to Act. Are we able to really do that kind of monitoring, which really evaluate this is the kind of working environment what people have for the breastfeeding mothers? Are they able to get the required support that is required? This is a big challenge.
Thank you, Dr. Rao. There are so many important points you made, and it was tempting me to put more probing questions, but in interest of time, we'll go to the next speaker. Dr. Sanjeev, you are a public health specialist, and you have been supporting government for various programs under RMNCHA. So when it comes to promoting breastfeeding, the approach which government goes is more from a campaign mode. So whenever there is a breastfeeding week, there is a huge buzz around it, but after the campaign is over, then again, we have to wait for one more year for implementing it. So what do you think, does campaign mode help? If yes, how can we improve it? Or if no, what are your suggestions?
So first of all, I would like to thank organizers for having me here. And I'm really enthused by seeing so many people sitting in this hall for listening, which is something very simple to say, breastfeeding. And they are here. We used to see crowded halls 2-3 decades back. So breastfeeding was such an important topic that point of time, but over a period of time, during the conferences of Indian Academy of Pediatrics, NNF or whatever, we have seen the interest coming down for such an important area which is breastfeeding. But I'm happy, I'm glad that we have so many people sitting in this hall. So coming to Sridhar's question, that we have this campaign every year. There is a week which is specifically dedicated for breastfeeding, promotion, awareness generation. And are they actually effective or not? When I was managing UNICEF's affair in 3 states, in the state of AP, Telangana, Karnataka, and this was my question to organizers, whenever they used to come for any sort of support, I said, what is the evidence whether it works? Or if you actually start looking at it, from India, there is hardly any evidence whether these campaigns are effective or not. There was one study which was conducted by Singh et al., and that says that these campaigns are helpful in improving the awareness about breastfeeding in masses. But that does not mean it actually affects the practices, means whether it is improving the data on early initiation of breastfeeding or exclusive breastfeeding on the age-specific complementary feeding. There was a study which was, means we have these evidences from other countries, not from India. There was a study which was conducted in 26 countries. It says that there was a measurable increase in early initiation of breastfeeding in 26 countries. There was, and due to these campaigns. But they also said, the author said, that it is possible if you have a supportive system for that. So unless you have an ecosystem to support this new awareness which is coming in masses, you are not going to get these, any kind of benefit out of it. There was another study which was conducted in Brazil. It says that these campaigns, they are helpful in improving, again, the something that awareness only for very short duration, but you are not able to change people's behavior. So we need to have an ecosystem for that. And but my question to Dr. Sridhar and everybody sitting in this hall, why we are talking about breastfeeding only for a week? Babies are being born throughout the year. They don't born only during this time. It happens. And we are seeing more and more, specifically in government programs, where we have now ORT fortnight, right? We are talking about ORS or diarrhea fortnight, so we are talking about ORS only during 15 days. We are talking about immunization only during Mission Indradhanush. So there is specifically time you talk about it. And this has become now more and more in different programs. And this is where we lose our steam. People feel that you need to talk about it only during a particular week or during a fortnight or a month, which is not the case. I think we should continue to talk about, or maybe I know there were people and some bureaucrats I know very well, and they were very, very hard on this, saying that we need to stop these special weeks, special fortnights, special months, special year. I mean, this has to continue throughout the year because you lose focus. So I don't know whether this benefited this whole breastfeeding or this is counterproductive in a way. But we need to generate more evidence. Probably it will lead to question to my fellow panelist who's next sitting to me, what sort of data this country requires for breastfeeding. So I stop here. Thank you, Dr. Sridhar.
So you have leaked my question. So taking from what Dr. Dadich and Dr. Sanjeev said, Dr. Jagdish, so we don't have evidence. And for policymakers to make a informed decision, they need a quality data. So what do you think, what kind of data we need to track and evaluate the success of breastfeeding, and how can data-driven policymaking improve breastfeeding rates in India?
So, the government is fundamentally responsible for the health of the mother and the child, and also for promoting breastfeeding. Dr. Usha has already enumerated the various programs which the government is promoting. But the success of any program depends upon tracking and evaluating the program very frequently. So there's a Global Breastfeeding Collective, which is led by UNICEF and WHO, they have come up with a global breastfeeding scorecard. This scorecard was actually brought out in 2017, and it is being updated every 5 years. So the latest scorecard is around 2023. So they have given about 16 indicators, and then they have coded it according to the efficiency of the program. They have coded it as green, yellow, orange, and red. So the main indicators in this are funding per live birth, each live birth. The second one is counseling of the mothers. Third one is community support. So when we are looking at these three main indicators, let us look at the data which we have got to collect. The most important data which we have got to collect is about 14 or 15 points, apart from what the WHO UNICEF collective has recommended. So the most important thing is we'll have to find out the education and also the knowledge and attitude of the mother. That is very important. If the mother, she doesn't want to feed, it's very difficult for us to convince her. Second thing, we need the counseling, whether the mother has been counseled prenatally by the obstetrician and the lactation consultant. Then third point which we are going to ask is whether when did the mother start feeding the baby? When was the first feed given? Whether the first feed was given within 1 hour, were there any pre-lactal feeds which are given? If the mother started feeding the baby, is it mixed feeding or only exclusive breastfeeding which is continuing? And what is the number of exclusive breastfeedings at 6 months? Then when did they start the complementary feeding? Whether the complementary feeding was started after 6 months or before 6 months. And if the complementary feeding was started after 6 months, how long did she continue to feed the baby? Is it after 1 year? What is the 1 year level? And what is the 2 year level? And what is the next question would be the workplace support. Whether the accommodation, whether she's got the leave, maternity leave, as what was discussed by JV, and then what is the support at home? Support at home by the family, by the community. These are the main questions which have got to be addressed. And then again, we'll have to find out whether the mother is suffering from any chronic illnesses and what are the deterrents for her to stop feeding the baby.
Thank you, Dr. Jagdish. The global score was information for me also. Thank you for that. And going back for next question to Dr. Usha Rani. Before this panel, we saw a session on use of technology. And I also have seen the e-essence use working in Nilofer Hospital. So with your experience, what do you suggest? How can these digital platforms or technology can be used for promoting breastfeeding?
Yeah, definitely. We all know this generation is called Y generation or internet generation. And if you look at the data, India ranks second in the world in the smartphone usage. So definitely, obviously, technology has been playing a major role in every aspect of life. Likewise in breastfeeding support also. So there are so many online videos, online education materials, like social media like Facebook, Twitter, podcasts, WhatsApp, and whatnot. And there are so many mobile apps which help mothers to maintain breastfeeding logs, breastfeeding reminders, and also to access lactation consultants online. So definitely digital tools are helping. They have a major advantage in that they are more accessible and they can give personalized support and instantly, whenever, suppose suddenly mother gets a doubt, instantly they can access the lactation consultant online. So, and also in the public sector, there are mobile apps which are developed by the government. In Maharashtra, they are using Sishu Poshan app, which helps in breastfeeding as well as infant feeding beyond breastfeed. And also in Karnataka, they've started using Best for Baby kit, which helps in healthcare workers to train the mothers at community levels in a step-by-step approach at every visit. And in our hospital, in Nilofer Hospital where I work, which has an average occupancy of 300 to 350 babies, so our neonatologist Dr. Alimelu and Dr. Swapna are here, they use WhatsApp group. We find WhatsApp group is easier. So daily we have nearly 30 to 40 discharges of newborn babies. So all those small preterm babies, multiple births like twins, triplets. So Swapna always posts every day in our group photos of success stories of breastfeeding. So the mothers, most of the mothers who come to Nilofer Hospital cannot read and write. But still, by voice messages, they interact with each other and they act as peer counselors and support other mothers who have problems with breastfeeding. So technology plays a major role and complements traditional health care.
Yeah, I think there's an immediate need to document the evidence, whether it impacts or not, so that we can convince the policymakers how to use the technology. Now, in the interest of time, it will be more rapid fire round now. Dr. Yadaya, Dr. Sanjeev talked about breastfeeding promotion weeks and all campaigns. But if you see the messaging in the campaigns, it is still focused on reducing stunting, reducing malnutrition and all. But there is so much of science that it works on early childhood development, the neurodevelopment, the cognition part of this. So what do you think? Do we need to change our approach for promotion of breastfeeding?
Regarding the breastfeeding and benefits, every time we are talking about the breastfeed because your baby get benefited, you benefited. But we should concentrate on the growth and development, and we should also tell them the increased mortality if you don't feed the baby at the early initiation. If you don't feed the baby in the immediately after birth, there is almost 33 times increased mortality to the baby. It should reach the mother. It should improve the knowledge of the mother and the family members that if you don't feed our baby immediately after that, there will be more chance of baby dying. This should go to the mind of the mother and the family members. And we should strictly implement the BFHI. It's not displaying on the posters. It should go into the nook and corner, and the healthcare professionals should understand the importance and implement it successfully. That's only the way. And the role of the counselor is very important, the lactation counselor. We say we should have good 4 antenatal visits. Like that, we should have 4 or 5 lactation consultant visits, because obstetricians are not going to tell about the breastfeeding because of their own hectic schedule. So, role of lactation consultant during the antenatal visit through counseling is very, very important in improving this early initiation.
Thank you, Dr. Ajay. Dr. Dajich, you have been part of IMS Act development also. So in IMS, even though there is IMS Act, the formula feeds are available over the counter. IMS Act says orphanages can buy formula feeds. So what is your critique on IMS Act?
Yeah, well, if I have to say one sentence about IMS Act, I will say that it's a very strong law and it's very effective. It's strong and the benchmark is WHO's analysis, yearly analysis, and they publish a report. And India's law stands in the most 25 countries where the law is satisfactorily aligned, significantly aligned with the International Code of Marketing. So India in 25 countries globally. Effective because since IMS Act has been enacted, India's breastfeeding rates have been increasing, and though we can say that all other factors are also contributing to it, but we have to provide a protected environment under which the support and promotional activities for breastfeeding they actually succeed. Also, if we compare with the countries where the law is not available, the expansion of formula market is much less in India. Say for example, in China it's 3 times of Indian market, although the number of deliveries are almost similar. Regarding the orphanages, well, this provision in IMS Act has been taken from the International Code of Marketing of Breast Milk Substitutes. The idea behind this is that, these institutions, they are catering to babies who are not having their mother with them. And it's more a kind of ethical issue rather than a legal issue, because when we say if a baby is not having his or her mother, then what we can feed to that baby? The science says that it should be either, the first thing is mother's milk, it's not available. Then the alternative is, can there be a wet nursing? It's again not available. Then can we have a donor human milk? Again, it's not available. Then the fourth option is remaining, that is the formula.
Feeds.
So, but again, the law doesn't provide, doesn't allow these organizations to pilferage and also to have promotional activities.
Maybe one of the solution is Datri chain of milk bank should spread across country.
Yes,
yeah.
That can be done, but I think that is, we have to work a lot for this. Yeah, thank you.
Okay, Dr. Dajich. Dr. Rao, whenever breastfeeding comes, it is seen as only a responsibility of the mother, and accountability is only with the mother. what do you suggest? How can the father, the family members, and the community at large can help or support breastfeeding mothers?
Right. I'll be very brief because I'm looking at this ticking time. So getting increased heart rate looking at that, as Dr. Naveen was mentioning again. But as Dr. Sridhar has rightly mentioned, many times we think that the responsibility of the exclusive breastfeeding or the breastfeeding per se is a concern only for the mother. In fact, many times the mothers come alone, unaccompanied also, many times to the consultation rooms, and sometimes one accompanying person. And another important thing is like the role of family as it is, and especially the husband or the father of the baby is very crucial, because to create a breastfeeding supportive environment, an enabling environment for the breastfeeding mother, this creating a proper environment at home itself is very crucial. For that, we need to create more awareness about them, involve them in the baby's care, give them psychological and emotional support, so that mother will be able to continue. She will have a lot of challenges regarding inadequate breast milk, or not able to feed the baby, and anxious about whether the baby is growing properly or not. These things have play a greater role. Where she is more anxious, her lactation will come down significantly. It will have an adverse impact.
Thank you. Thank you, Dr. Rao. Dr. Sanjeev, so you have been spearheading many programs when you were with UNICEF to bring the multisectoral coordination. Now, when it comes to breastfeeding within the government, the Department of Health is responsible, Department of WCD is responsible. We need to engage Labor Department, maternity leave comes under them, the Education Department. So what do you think, what kind of multisectoral coordination is necessary between all these departments to create more breast-friendly environment in India?
Very quick. First of all, India is one country where we do not have problem with right sort of policies. We have all policies in place. The problem is mostly with implementing those policies. And this is where we need to focus on. My second point is something which is not working for last 15 years or 10 years, then we need to change. We need to do it differently, and it is my suggestion to this August group in this house that we need to come out with some different sort of plan. I mean, we have a new generation sitting, we have millennials, Gen Z and what not. We need to position breastfeeding differently. It is not going to work the same way. So think of some new ways of doing this business, position it differently. And third thing is, the most important part, that we need to create an ecosystem. I was looking the breastfeeding models across the globe. And some countries, for example, the Philippines, Australia, they have a beautiful system in place to promote breastfeeding. They have peer support group, means the women who actually are breastfeeding their kids or who breastfed their kids in past, they are supporting other mothers. And they are very, very effective, and it is all already. No one is paid, unlike in India where you need to put a lactation counselor here, there, and what not. So these are my 3 cents. Thank you.
Thank you, Dr. Sanjay. So we are into the last question, Dr. Jagdish Chandra. So we have a lot of science of breastfeeding. Do you still see there are critical areas of research left for better understanding of science? Or do we still need to work on basic sciences or any operational research? What are your suggestions?
Actually, there's been a lot of research going on and trying to find ways which can really impress on the mothers the advantages of breastfeeding. But there are certain knowledge gaps also which we'll have to fill up. Like we have to look at the impact of breastfeeding on the infant's health, long-term benefits to the baby, whether it's going to really decrease the obesity, whether it is going to decrease the heart, cardiovascular diseases, diabetes and other things. And also we'll have to look at the benefits to the mother also. So it has been clearly seen in some of the studies that the mothers who have got chronic illnesses, when they are feeding the baby, the mothers are having a beneficial effect to their chronic illnesses. Let us look at these points, and there are other factors also which we'll have to look, the bonding between the baby and the mother, how it is going to really improve on the growth of the baby, brain growth. It has been noted that exclusively breastfed babies have a higher IQ, verbal IQ is increased by about 7.5%, for 7.5 points, and the performance IQ is increased by 9.9 points, and the total IQ comes to about 5.5 points above when they are exclusively fed on breast milk and prolonged feeding is there. So we'll have to look at all these points and look at the research which is done. Thank you.
Thank you, Dr. Rajesh. I thought within the 30 minutes time we'll not be able to complete first round of questions, but thank you to all the panelists that we completed both the rounds. We exited just by 5 minutes. So in this entire panel discussion, we tried to touch upon all the aspects of policy consideration, from facilities, from the existing programs, research, IMS Act, data, and the breastfeeding promotions. So I hope it was useful. Thank you, audience, for all the patience hearing. Thank you so much.
I would like to thank the moderator, Dr. Sridhar, for organizing such a great panel discussion, and for the speakers for giving their insights on the topic of policy considerations in promoting breastfeeding.